It's 3 o'clock in the morning. The house is quiet, and you wake up to use the bathroom. As you make your way back to bed, the same ache reminds you it is still there. Maybe it is your knee, maybe your hip, maybe your lower back, shoulder, or one stiff joint that seems to complain every time you move. You sit on the edge of the bed for a moment, still half asleep, wondering if you can get comfortable again. Then you notice the bottle on the nightstand. Ibuprofen. You have taken it before. You can buy it without a prescription. It helped last time, so it feels easy to think, I'll just take one and go back to sleep. For many adults after 60, that moment is very familiar. A sore knee before bed, a stiff back in the morning, a headache that keeps returning, a shoulder that aches after yard work. And because ibuprofen is sold over the counter, it can start to feel like a regular household item, not something that belongs in a serious medication conversation. But here's what many people miss. The issue is not one occasional pill. The issue is when ibuprofen quietly becomes a habit. That does not mean ibuprofen is bad for everyone. It does not mean you should panic if you have taken it before. Ibuprofen can be useful for some people when used as directed. But after 60, the question changes. It is no longer only, does this help my pain? The better question is this still safe for me? With my age, my stomach history, my kidneys, my blood pressure, my heart health, my other medicines, and how often I am taking it. This video is for education only. It is not a diagnosis, and it is not a treatment plan. Do not start, stop, skip, or change any medication based on this video. If you take ibuprofen often, if you are thinking about using it daily, or if you take aspirin, blood thinners, steroids, antidepressants, diuretics, blood pressure medicines, other pain relievers, or multiple medications, talk with a qualified healthcare professional or pharmacist. And if you develop chest pain, shortness of breath, weakness on one side, trouble speaking, bloody vomit, black stools, severe stomach pain, fainting, swelling, allergic symptoms, or symptoms that are new or getting worse, seek medical help promptly. Before we talk about the risks, it helps to be clear about what ibuprofen actually is. Ibuprofen belongs to a group of medicines called NSAIDs, which stands for non-steroidal anti-inflammatory drugs. People use these medicines for pain, fever, and inflammation. That is why ibuprofen may seem helpful for joint pain, back pain, headaches, muscle aches, or soreness after activity. The word over-the-counter can make it feel harmless. But over-the-counter does not mean risk-free. It only means the medicine is available without a prescription at certain strengths, with directions and warnings on the label. It still affects the body. It can still interact with other medicines. And after 60, the body may not handle medicines the same way it did years earlier. That is why the pattern matters. Taking ibuprofen once in a while for a short-term issue is different from taking it most days because the same pain keeps coming back. If you find yourself reaching for it every morning, every night, after every walk, after every round of chores, or whenever you need to sleep, that is worth discussing. Not because you did something wrong, but because repeated use changes the safety conversation. One of the biggest concerns is the stomach. Ibuprofen and other NSAIDs may increase the risk of stomach irritation, ulcers, or bleeding. That risk can be higher for adults age 60 or older, especially if there has been a history of stomach ulcers or bleeding problems, if someone takes blood thinners or steroid medicines, if they take other NSAID-containing products, if they drink alcohol regularly while using it, or if they take more than directed or use it longer than directed. What makes stomach bleeding concerning is that it may not always begin with an obvious warning. Some people may notice stomach pain or heartburn. Others may notice black or tarry stools, blood in the stool, vomiting blood, or vomit that looks like coffee grounds. Those are not symptoms to watch casually at home. They are warning signs that need medical attention. Another issue is that many people do not realize they may be doubling up. Ibuprofen may be one bottle in the cabinet, but NSAIDs can also appear in other products. A person might take ibuprofen for knee pain, then take another pain reliever, cold medicine, or prescription product without realizing there may be overlap. That is one reason your full medication list matters so much. And the full list means everything: prescription medicines, over-the-counter medicines, vitamins, supplements, herbal products, aspirin, pain relievers, sleep aids, allergy pills, cold medicines, anything you take only once in a while. If it goes into your body, your doctor or pharmacist should know about it when you are asking whether ibuprofen is safe for you. The kidneys are another part of the story. NSAIDs can affect blood flow through the kidneys in some people. That may matter more if someone already has kidney disease, reduced kidney function, high blood pressure, heart disease, heart failure, liver disease, dehydration concerns, or takes certain blood pressure medicines or diuretics. This does not mean every person who takes ibuprofen will have kidney problems. It means kidney health is one of the reasons ibuprofen should not casually become a daily routine after 60 without guidance. The timing matters here too. If you are sick, not eating well, vomiting, having diarrhea, sweating more than usual, or drinking less because you are trying to avoid bathroom trips, your body may be under different stress than usual. Taking an NSAID during those times may deserve extra caution, especially if you have kidney or blood pressure concerns. The safest step is not to guess. It is to ask your clinician or pharmacist what applies to your situation. Blood pressure is another reason to be careful. NSAIDs can sometimes contribute to fluid retention or make blood pressure harder to manage in certain people. If your home blood pressure readings have changed, if your ankles seem more swollen, or if you feel more short of breath than usual, do not assume ibuprofen is the cause. But do tell your healthcare professional what you have been taking and how often. The same cautious thinking applies to heart and stroke risk. Some NSAIDs may increase the risk of heart attack or stroke, and that risk may be higher in certain people, especially those with heart disease or longer patterns of use. This does not mean one pill automatically causes a crisis. Fear-based thinking does not help, but daily or frequent use deserves a conversation, especially if you have a history of heart disease, high blood pressure, stroke, chest symptoms, or several risk factors. There is also a special question for people who take aspirin for heart protection. Some people take low-dose aspirin because their doctor told them to. Then they take ibuprofen for pain without thinking much about the combination. But timing and interactions can matter. The right answer depends on the person, the reason for the aspirin, and the clinician's guidance. So if you take aspirin, do not guess. Ask your doctor or pharmacist how ibuprofen should be handled, or whether another approach may be safer for you. Alcohol is another detail many people leave out. Someone may have a drink with dinner and take ibuprofen later for pain. Someone else may take it after a long active day and also have a few drinks. Regular alcohol use can add to stomach bleeding concerns, with NSAIDs for some people. This is not about judgment. It is about giving your doctor or pharmacist honest information so they can help you understand your personal risk. One common mistake is thinking it is sold without a prescription, so I do not need to mention it. But for older adults, over-the-counter medicines are part of the medication picture. If your doctor asks what you take, ibuprofen belongs on that list, even if you bought it at the grocery store. Another mistake is using ibuprofen again and again without asking why the pain keeps returning. Pain after 60 is common, but it still has a pattern. Is it one knee, one hip, your lower back, your hands? Does it happen after walking, after sitting too long, after stairs, after gardening, or at night? Is it getting worse? Is it changing how you walk? Is it making you less steady? Is it waking you up and sending you through the house in the dark? That last point matters. Pain and medication habits can quietly affect independence. If pain wakes you at night, you may walk to the bathroom or kitchen half asleep. If you are stiff, groggy, wearing loose slippers, or moving through a dark hallway, that can become a fall risk moment. If you are also feeling dizzy, weak, lightheaded, or unsteady, that is something to discuss with your healthcare professional. The goal is not only pain relief, the goal is safer daily function. A third mistake is taking ibuprofen longer than the non-prescription label says without asking. If pain lasts for days and days, if fever persists, or if you feel you cannot function without taking ibuprofen repeatedly, that is not just a pain reliever question. That is a reason to ask what may be causing the ongoing problem and what options fit your health history. A fourth mistake is assuming that natural options are automatically safer. Supplements, herbs, topical products, and other pain strategies can also have risks, interactions, or limitations. Some may be appropriate for some people, some may not be. The safest question is not, what is the strongest thing I can take? It is, what is safest for me, given my conditions, medicines, and goals? So, what should you actually track? Start with how often you take ibuprofen. Is it once a month? Once a week? Several days in a row? Most days? Twice a day? Only at night? Only after activity? Write down the pattern honestly. This is not about guilt. It is about clarity. Then track why you take it. What pain are you treating? Where is it? How long has it been going on? What makes it worse? What makes it better? Does the pain affect walking, sleep, balance, dressing, cooking, driving, or stairs? If you are taking ibuprofen so you can get through normal daily tasks, your doctor should know that. Then notice what else is happening. Any stomach pain, heartburn, nausea, black stools, unusual bruising, bleeding, swelling in the feet or ankles, changes in blood pressure, shortness of breath, dizziness, weakness, or changes in urination. Did those symptoms begin after you started taking ibuprofen more often? Did they appear after a new medicine, new supplement, illness, dehydration, or change in routine? Also track what you take with it. Aspirin, blood thinners, steroids, antidepressants, diuretics, blood pressure medicines, other NSAIDs, cold medicines, alcohol, supplements, herbal products. You do not need to understand every possible interaction on your own. You simply need to bring the complete list to someone who can review it. When you speak with a doctor or pharmacist, be specific. Instead of saying, I take ibuprofen sometimes, you might say, I have been taking it most nights for my knee for the last 3 weeks. Or, I take aspirin every morning and sometimes take ibuprofen for back pain. Or, my blood pressure readings have been higher since I started using it more often. Or, I have kidney disease and wanted to ask before using it. Or, I drink alcohol with dinner and take ibuprofen at night for pain. Those details help the professional give safer guidance. They may discuss whether ibuprofen is appropriate for you, whether the dose and timing are safe, whether your other medicines matter, whether your kidney function or blood pressure should be reviewed, or whether the pain itself needs evaluation. They may also discuss non-medicine options or different pain strategies that fit your situation. But that guidance should be personal, not guessed from a label or a video. There are warning signs that should not be ignored. Seek medical help promptly if you have chest pain, shortness of breath, weakness on one side of the body, slurred speech, sudden vision changes, fainting, or symptoms that feel sudden and serious. Also seek help for vomit that is bloody or looks like coffee grounds, blood in the stool, black or tarry stools, severe or worsening stomach pain, severe heartburn, difficulty breathing or swallowing, hives, facial swelling, rash, blisters, peeling skin, unusual swelling in the feet or ankles, unexplained weight gain, severe fatigue, yellowing of the skin or eyes, or symptoms that are new or getting worse after using ibuprofen. And remember, pain itself can be a signal. If pain lasts longer than expected, keeps returning, wakes you at night, changes your walking, causes weakness, limits your daily life, or makes you depend on ibuprofen regularly, it is worth asking why. The purpose of this message is not fear, it is awareness. Ibuprofen is not automatically forbidden after 60. Many people may use it safely in certain situations when they follow directions and have no major risk factors. But making it a daily habit without asking is different. After 60, your stomach, kidneys, blood pressure, heart health, alcohol use, aspirin, blood thinners, steroids, other medicines, and the reason for the pain all deserve attention. This video is for education only and should not replace medical care. Do not start, stop, skip, or change medication based on a single video. If you are using ibuprofen often, if you want to use it daily, or if you have kidney disease, heart disease, high blood pressure, stomach ulcers, bleeding problems, heart failure, take aspirin, blood thinners, steroids, antidepressants, diuretics, other NSAIDs, or drink alcohol regularly, talk with a qualified healthcare professional or pharmacist. Over-the-counter does not always mean risk-free after 60. Before ibuprofen becomes part of your daily routine, ask. Bring your full medicine list. Track how often you use it. Notice warning signs. And treat pain not as something to hide or push through, but as information that can help you protect your comfort, your safety, and your independence.